In critiquing proposals in the 2020 budget for the health sector, Opposition Member of Parliament Sharon Holder lamented the immense suffering of patients having to wait lengthy periods for life-saving surgeries pre the coalition government. Holder, who referred to his opponents on the government side of the bench as honorable copycats, stressed that the health sector was in a grappling state before the APNU-AFC administration took over in 2015. He highlighted that the sector constantly endured drug shortages for a number of reasons.
Basic over-the-counter medication was a scarcity in the region. Mr. Speaker, it was due to the PPP incompetence, total mismanagement of the sector, and rampant corruption to which they turned a blind eye.
In the 2020 budget proposal, the PPP administration also outlined an acute shortage of drugs and medical supplies across the country. The proposal, which was presented by Minister of Public Works Juan Edgel, also alleges mismanagement of the healthcare system during the APNU-AFC's tenure. From a whopping $51.7 billion, which has been allocated to enhance the health sector, the PPP administration has pledged $14.3 billion alone for the procurement of drugs and medical supplies. Meanwhile, in the 2019 budget prepared and presented by the coalition in 2018, $7.8 billion was allotted for the same purpose, that is, to procure drugs and medical supplies. However, the government has since claimed that a full review of quantification and procurement practices is being undertaken, since there's a lack of evidence of any purchased drugs and medical supplies since 2017. This is against the backdrop of a $539 million drug storage bond being built at Kingston, Georgetown in 2019, and another $161 million being put towards the extension of the drug bond at Diamond East Bank, Demerara in the same year. Holder placed emphasis on some of the successful projects that were carried out during his party's rule to bring some relief to the prevailing issues in the health sector.
Extension to the drug bond at Soddy Hospital, construction of the accident and emergency unit at Charity Hospital, construction of new theater at Soddy Hospital, thereby increasing the number of surgeries, construction of a maternity waiting home, providing better services to our pregnant women, and rehabilitation of the Oscar Joseph Hospital after years of neglect by the PPP.
Temika Rodney reporting for the HGB Nightly News.